Let me recapitulate the anatomy of gastrointestinal tract. Weakly acidic drugs like aspirin and paracetamol are absorbed from the stomach. It has a limited surface area unlike the intestine, which has microvilli, and therefore the absorption of drug from stomach is relatively less. The pH of the stomach ranges from 1 to 3 due to the presence of hydrochloric acid. The pH again varies in the small intestine, from duodenum to jejunum and then to ileum. Basic drugs like theophylline and morphine are absorbed from this region. In the small intestine, mucosal surface area is very large due to the presence of microvilli. This facilitates the passive absorption of drugs. The pH ranges from 5 to 7 and is favorable for majority of the drugs to remain unionized. Small intestine also contains carrier systems for the active transport or uphill transport of the necessary nutrients. The colon, on the other hand, has a limited surface area. The pH ranges from 7 to 8. The drugs from enteric coated formulations are released here. It is absorbed from the colon, like indomethacin. The factors which affect absorption are physiochemical, physiological, and dosage form factors. Today, we are going to talk about the physiological factors. The physiological factors include age, gastric emptying rate and time, intestinal transit, gastrointestinal pH, disease state, gastrointestinal contents, and presystemic metabolism. First, let's talk about age. One must keep in mind that relative to adults, in infants, the gastric pH is high. Other than gastric pH, the intestinal surface area and blood flow to the GIT is low. This results in altered absorption pattern in comparison to adults. Whereas if we talk about elderly patients, altered gastric emptying and decreased intestinal surface area and GI blood flow could cause impaired drug absorption. Now let's talk about gastric emptying. Before we go ahead, remember the three terms. 1. What is gastric emptying rate? It is the speed at which the stomach contents empty into the intestine. Gastric emptying time is the time required for the gastric contents to empty into the small intestine. And gastric emptying T half is the time taken for half the stomach contents to empty. Now, as I've just mentioned that most of the drugs get absorbed in the intestine. This is why we can say that gastric emptying is a rate limiting step in drug absorption for majority of the drugs. So generally speaking, faster is the gastric emptying, more is the bioavailability. Now, in what cases there is a need of fast gastric emptying? Let us say you want rapid onset of therapeutic action. In that case, the contents should pass quickly from the stomach to the intestine to get absorbed. Okay, so in case of rapid onset of therapeutic action, we want rapid gastric emptying. Then, in the case of drugs which have dissolution in the intestine, what are such drugs? The oral dosage forms which are enteric coated. In that case, gastric emptying should be rapid. But then there are also conditions, you see, where delay in gastric emptying is required. Okay, what are those conditions? They will be quite contrary to the one which we just discussed. For example, the drugs whose disintegration and dissolution, or rather we can say the dosage forms whose disintegration and dissolution is promoted by gastric pH, or we can say gastric fluids, or the drugs which irritate the mucosa. Aspirin, if you take, the side effect is it irritates the gastric mucosa. In that case, delay in gastric emptying is. Now, what are the factors which influence the gastric emptying? Now, one major factor which affects the gastric emptying is the meal that you are consuming. So, under the meal comes the volume of the meal, the composition of the meal, and the viscosity of the meal. Now, in comparison to the body temperature, if the temperature of the ingested fluid is higher or lower, it reduces the gastric emptying time. If the bulk of the meal is high, gastric emptying time will be naturally longer. Generally speaking, gastric emptying time is 3.1 hours, though it shows considerable inter-subject variation. You should also understand that liquid meals take less than an hour to empty the contents from the gastric region. Solid meals may take as long as 6 to 7 hours. You see, why the liquid meals take less time? Because of the free flow of materials by gravity. So viscous materials generally empty at a slower rate in comparison to less viscous materials. Then amongst fats, proteins and carbohydrates, fats decrease the gastric emptying and carbohydrates have fastest gastric emptying. First is carbohydrates, then comes the proteins and then comes the fats. In the condition of emotional stress and anxiety and in disease states like gastric ulcer, diabetes, the gastric emptying rate decreases. Drugs such as antacids and antiemetics stimulate gastric emptying. Also, water and isotonic solutions empty the stomach rapidly. Now, a similar factor is intestinal transit. Small intestine is the major site for absorption of majority of drugs. Therefore, long intestinal transit time is required for better absorption of these drugs. So, for drugs which dissolve only in the intestine, like the enteric coated formulations, or the drugs which penetrate in the intestinal mucosa very slowly, for example, acyclovir, or if we talk about the sustained release products, in these cases, delayed intestinal transit is desirable. Just like gastric emptying, intestinal transit is influenced by various factors like foods, drugs, and disease state. For example, laxatives promote the rate of intestinal transit, whereas drugs such as anticholinergics retard the gastric and intestinal transit. This promotes the absorption of poorly soluble drugs. In this diagram, as we go down the stomach to the colon and rectum, we see a gradual increase in the GI pH. The next factor which affects absorption is gastrointestinal pH. The disintegration, dissolution, and absorption of dosage forms is clearly influenced by the gastrointestinal pH. Let us take an example of, of an enteric coated tablet. Now, the specialized coating which is done to make it enteric coated, the coat dissolves only in the intestine and then the disintegration of the tablet takes place. This way, the disintegration of enteric coated formulation is pH sensitive. Then is the dissolution. Weakly acidic drugs dissolve rapidly in alkaline pH of intestine, whereas basic drugs dissolve in acidic pH of stomach. Since the primary site of absorption for most of the drugs, as I have discussed before, is small intestine, poorly water-soluble basic drugs must first dissolve in acidic pH of stomach and then move to the intestine. The pH also affects the stability of a drug. For example, erythromycin. Erythromycin, acidic stomach pH affects the degradation of erythromycin. Various pathological conditions affect the absorption of drugs. Crohn's disease, which is characterized by inflammation of digestive tract, can alter the absorption pattern. Celiac disease, characterized by destruction of villi and microvilli, may increase the gastric emptying rate. As the gastric emptying rate will increase and GI permeability will increase, Altered intestinal drug metabolism and impaired secretion of bile will affect the absorption of lipophilic drugs. Gastrectomy may result in drug dumping in the intestine. Cardiovascular diseases cause edema of the intestine, thus decreasing the blood flow to GIT and altering the gastric emptying rate. Drugs which undergo first-pass metabolism are greatly affected in case of hepatic cirrhosis. Enhanced bioavailability is observed in drugs which undergo first-pass metabolism. Various enzymes and proteins are present in the GIT. Their interaction with the drugs leads to altered bioavailability. For example, chloramphenicol palmitate with the help of pancreatic enzyme gets converted to chloramphenicol, which then gets absorbed in the blood. Bile salts enhance the dissolution of poorly water-soluble drugs. This promotes their absorption. For example, griseofulvin. Then, drugs like neomycin, they react with the anionic bile salts and form non-absorbable complexes, thus leading to poor absorption. Mucin is a mucopolysaccharide. It is present on the epithelial surface lining of the GIT. So when drugs are given orally, the drug first encounters this layer of mucin before getting absorbed. Some drugs interact with the mucin. As a result of their interaction, they form non-absorbable complexes. This results in irregular absorption. An example is streptomycin. Streptomycin binds to the mucin in substantial amount. As a result, its absorption is decreased. Before the drug reaches the blood circulation, it has to pass through the liver from the GIT. The loss of drug by such eliminating organs due to its passage to systemic circulation, during its passage to systemic circulation is first pass or pre-systemic metabolism. The reduced concentration of drug in plasma after oral administration is indicative of first pass effects. Various enzymes such as digestive enzymes, bacterial enzymes, hepatic and gut wall enzymes affect the pre-systemic metabolism of a drug.